Hi, I am Dr. Thejaswi, Consultant Minimally Invasive Cardiothoracic Surgeon, Sooriya Group of Hospitals, Chennai. So today I am going to explain you the recent trend, which is an early onset of coronary artery disease in young adults. So there has been a lot of news saying young patients, young individuals getting heart attack and small kids getting heart attack, children succumbing to heart attack in the schools. It's not a recent onset that children are getting cardiac events in the school. It's just that through the institution of social media, we are more and more becoming aware of events worldwide. Even earlier, sudden cardiac deaths due to cardiac events were high in the younger age group having hypertrophic obstructive cardiomyopathy. Hypertrophic obstructive cardiomyopathy is a known condition to cause silent cardiac deaths, silent sudden cardiac deaths leading to mortality. So this is by a condition called hypertrophy of the septum of the left ventricle, which leads to obstruction of the left ventricular outflow, wherein the patient doesn't have adequate output to the body, leading to arrhythmias and cardiac death. So this was seen even earlier. The recent events which happened with small kids are related to such events. So nothing to be panicked regarding those events. We need to have children checked for cardiac health by at least an echocardiogram. So these are not heart attacks. Do not confuse it to heart attacks which are called myocardial infarction, which happens in adults. Yes, today young adults are getting heart attack due to the poor lifestyle, that is stressed lifestyle, too many hours of work, more than like 12 to 16 hours, and then not taking adequate rest in terms of sleep, which is of less than 8 hours is really not recommended. 8 hours of good peaceful sleep is very important for a replenished lifestyle and work the next day. And eating habits have to be very patterned. The person has to have a stipulated time of eating, not erratic eating habits and eating junk. Exercise in terms of minimum walking is required to maintain a healthy heart style. So today, all these young adults who have had heart attacks, who have had mortalities in gyms are related to one such events wherein they have maintained either an unhealthy sleeping habit or unhealthy eating habit or an poor exercise patterns. So you should take up all the patterns and lead a healthy, balanced lifestyle to have a healthy heart. Otherwise, these leads to early problems of heart diseases like heart attack. Heart attacks happen due to a disease called atherosclerosis, which affects the blood vessels of the heart. Atherosclerotic plaques in the blood vessels of the heart during a stressed lifestyle ruptures and leads to accumulation of platelets, thereby cessation of the blood supply to the particular region of the heart, leading to a myocardial infarction. When the myocardial infarction is very massive or comprising of more than one territory of the heart, it might be life-threatening. That is the time when the patient has to be immediately taken to the hospital and resuscitated, and immediate services like thrombolysis or angioplasty has to be done to save life. So the early recognition of such events is very important, and cardiac pulmonary resuscitations in the place of the event is very important in order to revive the patient and then immediately shift the patient to a healthcare system where we can provide advanced cardiac facility. So here in Sooriya Hospital in Vadapalani as well as Nungambakam, we provide top-notch healthcare facility wherein angiograms, angioplasties and heart surgeries are done with high-end equipments and latest facilities like minimally invasive cardiac surgery. You don't have a central scar on the chest. Rather, it is done through a minimal incision on the lateral chest which is around 4 or 5 centimeter incision, by which we treat the heart disease and render the patient back to his normal life within a week's time. So early rendering of patient's normal lifestyle is the way in which Sooriya takes it forward for treating heart care. Thank you.